when they're uncluttered, tend to be a lot more successful, because imagine, a doctor doing 5 visits in a day and he's constantly, entering information into this software. You want to make sure that the system that's being used is free of flaws. So, especially if they're entering, important kind of medical records. And so what we talked about in the first section was removing that variable of adding all those extras in that might confuse people, or, if you have too many sections where different information is housed, things might get overlooked. So it's really important, especially in healthcare design, to make it as simple as possible. Make sure that if, the text isn't easily readable, that you have icons that can kind of lead people around the page. It's said that the more it's refined, the less opportunity for error. So making it as simple as possible is really important. In dealing with the user interface design, it's really important that these apps portray, positive colors, positive language. Healthcare is kind of something that most people feel a little bit vulnerable sharing with others, even if it is their doctor. When you are doing remote care, anything through technology, you kind of take that personality and the sort of personal feeling out of sharing sensitive information. So these apps need to seem trustworthy and secure. Again, if something is too complicated and maybe over someone's head, they're going to feel even more vulnerable. So you want to make sure that you kind of take out any off-putting or inhospitable aspects to the app or software. If you make someone feel like they don't really understand something, they're not necessarily going to want to put information, like personal information, out there. A couple of key user interface sort of techniques to consider when designing these apps, and really a lot of apps in general, is the importance of creating kind of a contrast, also establishing hierarchy, reducing signal to noise ratio. These all are things that help not only healthcare apps to perform better, but designs in general. So really creating those contrasts will help to kind of get people to understand the bigger topics and maybe where the next page will lead them, or if the main purpose of their app is to enter in heart rate information or something like that, those bigger sort of icons will help to lead people, especially people who don't know how to use apps, around the page. So these are all kind of important things to consider. And obviously, all of these aspects are tested by people from different demographics or different backgrounds, and those sort of hierarchical changes or contrasts are adjusted to fit the needs of those people. So again, this is where prototyping would come in. The designer could maybe design a couple different options for the user testing and see what hierarchy changes or color contrast or language is working out better for patients. And then they can kind of voice their opinions, and based on those positive or negative feedbacks that they receive, they can kind of optimize that for the final product. So kind of differently than, the look and feel of what the app or software looks like, privacy is really important when designing a health-related app, because there is a lot of sensitive information, and there are regulations by the Health Accountability, Portability, and Accountability Act, which is also known as HIPAA, that protects sensitive medical information and patient privacy. So apps, before they're even available for people to use, have to follow a strict set of guidelines that protect people from their information being, released to the public, or just basically they're put in place so that private information stays safe. And obviously Apple, has to have strict guidelines with this as well, because they have all the applications that are, housed within their program. So they have very, very strict set of guidelines, and even if one rule is broken, or if one part of their guideline list is not being met, they will reject the app until it is totally fixed. So This just ensures that, there's so many apps out there. It just ensures that any information that anyone puts into any app is going to be secure and confidential. Following these regulations, especially through HIPAA guidelines, it makes user testing that much more important. Testing is actually critical to be able to follow the HIPAA protocol. So any errors with the app that would, inhibit saving information on allergies or pain levels, symptoms, or, mixing up patient data, those are all things that could be, detrimental to somebody's health. So the user testing and, making sure that the app works in many different situations, maybe no Wi-Fi or on different phone interfaces or operating systems, making sure those things work in every situation is really important because say information doesn't get saved and the information doesn't reach the doctor and someone gets a prescription for a drug that they might be allergic to, those are situations where, these apps having, optimal usability it's where it's really important. There's several aspects. There's tons of aspects that go into this testing, but a couple more general ones would be, testing units of measure, the use of medical imaging, language barriers, so, the type of language that's used on the site. If someone's unable to read, are they still able to use this? The color palette readability, so maybe someone who's colorblind, can they still process the colors that are being used? System backups, and also, again, if the app works on different mobile platforms, and for, again, people who are dealing with poor connectivity. So if someone's receiving remote care, they might live in a very remote location where Wi-Fi and internet isn't always available to them. So these are all things to kind of consider when going through creating one of these healthcare apps. So for the third and final section, we're going to kind of focus on the negatives of the current healthcare information and communication technology system. So in short, what's not working with the current systems that they have. So the current system is known for being really complicated, really expensive, and just overall low quality. It has like a really low rating from doctors and patients. And this current system is called Electronic Health Records. It's also known as EHR. And basically, it's a large database of electronic records of patients' medical history. So this obviously plays a huge role in designing a healthcare app or website because all of that information that's being put in there has to be housed within this EHR system. Typically, these systems house information like demographics, notes, medications, vitals, overall medical history, shots, immunizations, and various reports of tests that have been done. So I've included some examples here of current EHR systems, and these are from Epic and Allscripts. These are kind of two widely used systems. And as you can see, their overall kind of design and aesthetic is pretty clinical. There's a lot of information just put on one page, and you could see how this might possibly confuse someone, especially if they're doing, entering information in there all day, and there's, thousands and thousands of patients that they're dealing with. So to improve the UX of this page, I think kind of creating a navigation around the page, maybe, having one major topic lead you to a full page of vitals, or maybe have, heart rate information on a separate page. Try to separate some of the pages to make the signal to noise ratio a little bit less. There's a lot going on here, and I think, the more that you take out all of that clutter and confusion, it would make the page a lot easier to use. In regards to the UI, possibly adding a little bit of a warmer look to the page, adding color, contrast, maybe, different fonts, nothing too complicated, but at least something that would give, the patient or the doctor something more pleasing to look at. Also, the integration of infographics. Some of these pages are geared more towards physicians, but again, the pages that are geared more towards patients, definitely need to include more infographics, especially if there is a language barrier or if the person doesn't know how to read or has, a certain disability that prevents them from being able to, navigate around an app or website like this. So that might just help to kind of, with, wayfinding skills, figuring out how, the design is sort of leading them around. I really wanted to kind of compare and contrast good versus bad systems. But a lot of the research that I did, I wasn't finding many complete, examples of good systems out there. There's a lot of design students that have done projects on this, and I've kind of pulled a couple examples here and there of what I think, based off of the research that I've done, maybe handles these pages a little bit better with less clutter, a little better hierarchy and contrast and addition of color. Um, even for doctors, maybe, their software is going to be a little more clinical, obviously, because they're doctors. But still, they've added some of those elements that make, reading charts and graphs a little more visually appealing and less confusing. Healthcare has always been such a tough sell to create, more appealing designs because many of the software developers that originally created these, EHR systems and things like that were so focused on just being able to house all of this complex information on one sort of interface, and they sort of ignored all of the other aspects of making those interfaces a little more visually appealing. So now that we have all this information, we have these systems in place that can hold all this information, and we know how technologically we can kind of make it all work as one web. I think a lot of UX and UI designers are considering ways to make this more visually appealing and to make it easier for people to use in their everyday lives, as well as physicians to be able to use it within hospitals or for remote care. When I began this paper, I was doing a lot of research and I came across a lot of UX and UI sites and blogs that people had written, that designers had written. And it's definitely a topic that's been talked about a lot recently, which is really good. So it means that people are thinking about it. I'm sure there's designers out there who are working tirelessly to kind of rein in some of this complicated information and figure out how to make these systems better. I really wanted to compare and contrast some, really bad systems with really good ones and how, what specifically visually and, through research, what is working. Unfortunately, I didn't find a lot of really good examples. They might just be hard for me to find, via the internet. They might be more accessible, through actual healthcare, programs. But from what I found, it was really interesting to see all the research that's going into it currently and what designers are thinking about for the future. This paper was also really interesting for me to do as kind of a new designer to understand what role, design plays in the greater picture of things. This is my first year as a designer in the Kent master's program, and I just found this project so interesting because there's so many ways that design can impact so many different people, not just doctors or not just patients, but the amount of research that goes into figuring out how these systems could really help people in the long run. I really enjoyed doing all the research on this. A couple of my main goals were A, to learn more about UX and UI, and B, kind of focus it on healthcare because I think it's obviously a really important topic, and I know it's been changing, at least over the last 10, 15 years. So I wanted to see kind of what developments people have made and what the, direction for the future will be.